All veterans, whether healthy or ill, young or old, receiving healthcare in a clinic, hospital, or at home, deserve to have their wishes heard and healthcare preferences honored. This is one in a series of stories about veterans' values, goals, and preferences. This is Ronan's story about how caring for his dad influenced how he thinks about his own future healthcare. Ronan served in the Army during Operation Iraqi Freedom. Now he works as a volunteer firefighter, and even though he is healthy and happy, he worries about occupational hazards and other unexpected realities of life. 10 years ago, he served as his dad's surrogate and made medical decisions on his dad's behalf when his dad had prostate cancer and could no longer speak for himself. Ronan had talked with his father several times about what kind of care and treatment his father wanted. Ronan appreciated that his dad had gifted him with clarity and open communication about his health preferences, including that he wanted to stay on a breathing machine to allow time for final goodbyes prior to his death. Although Ronan is healthy, he asked his VA social worker about ways he could voice his healthcare preferences clearly for his wife and young son should he become ill or should something happen and he was unable to communicate. The social worker set up a time to meet with Ronan to discuss what his preferences would be if he were to experience an accident or medical emergency. She also assisted Ronan in completing an advance directive to document his preferences. For Ronan, being a good son meant knowing his father's wishes and honoring them. When Ronan became a dad, he wanted to make sure his wife understood his wishes to give them both peace of mind. Talk to your healthcare team about what's important to you and how to ensure that your preferences for healthcare are documented in your electronic health record. For additional information, visit the VA National Center for Ethics in Healthcare's website at www.ethics.va.gov/veterans.asp.